Good afternoon, everyone, and welcome to this fourth episode of the webinars organized by the EU-funded project Kidney Care. We have organized these webinars in order to commemorate or celebrate the World Kidney Day that took place the last 12th of March. And thank you very much, all of you, for being here and to be part of this webinar. We are going to wait around 5 more minutes in order to give the chance to people to participate. So see you in a bit. Hello, everyone, and welcome to this fourth webinar organized by the EU-funded project Kidney Care. In the past few days, we have had very interesting webinars with different partners from our consortium. We've had webinars regarding green dialysis technologies organized by the University Hospital from Utrecht. in the Netherlands, and also some other webinars from organized by the Center for Sustainable Healthcare, in which we have showcased some of the things that the clinical sites inside of the Kidney Care project are doing for this project, and also to make the kidney care more sustainable. Today, we have the honor to have our other members from the consortium, who is the European Kidney Patients Federation, EKPF, with Juan Carlos, Julian Mauro, and Monica Suengas, who are going to be the moderators of this webinar. The webinar is titled Sustainable Kidney Care, Listening to Patients in Times of Climate Change. So what's the webinar going to be about? So the webinar will explore the intersection between kidney disease dialysis, transplantation, and environmental sustainability. And it will address how energy policy, environmental research, and patient advocacy can contribute to a more sustainable healthcare system, particularly in the field of nephrology. And we have two very important speakers who we have the honor to have over here, notwithstanding their lack of time and all the things that they have to do for their job. So we have Paulo Zoio and Professor Rajmund Michalski. I leave the floor to our partners from EKPF to present the webinar and to present also the speakers in a more formal way. Welcome, everybody.
Thank you very much, Cesar, and good afternoon, everyone. Welcome to this session, as Cesar mentioned. So, let's get started. Sustainability in healthcare, it's not only about reducing environmental impact, it is about ensuring that systems remain resilient, equitable, and responsive to patient needs, particularly for those living with chronic conditions such as kidney disease. So people living with chronic kidney disease are among the population most vulnerable to climate change. And this makes it essential to include their voices in shaping future solutions. So, this is what we're going to explore today, how sustainability interacts with patient experience, with the quality of care and access. So now, Juan Carlos, I invite you to briefly introduce our speakers, please.
Thank you, Monica. Today we have two speakers. The first is Professor Rajmund Michalski from the Institute of Environmental Engineering of the Polish Academy of Science in Zabrze, Poland. His research focuses on analytic methods used in environmental protection, food analysis, and clinical research. And his actively involved in several European science initiatives. Professor Michalski also brings personal insight to this topic, as he has lived with kidney disease throughout his life and is now 13 years post-kidney transplant. We're also serving as president of the Patient Association, My Kidney, a member of the EKPF in Poland. And the second speaker is Paulo Zoio. Paulo Zoio is police officer at the Portuguese Directorate General for Energy and Geology, where he works on energy efficiency, sustainable energy system, and EU climate and energy policies. He has background in chemical engineering and is currently pursuing doctoral research in sustainable energy system at Instituto Superior Técnico in Portugal. Paulo also brings a valuable patient perspective, having lived with kidney disease since childhood and activity advocating through the Portuguese Patient Association appeal, also member of our EKPF network. And beyond his professional and advocacy work, he's also involved in generative agriculture, managing in this moment a 35th organic farm in the Serra São Mamade, focused on biodiversity and sustainable land management. We are very pleased to have both with us today. And Monica, let's begin the connecting between environmental change and the kidney health.
Yes, sure. Thank you, Juan Carlos. So, Rajmund, let me start with you. I wanted to
Yes.
ask you, how is climate change expected to affect kidney health and people living with chronic kidney disease in the coming years?
Thank you very much, Monica and Carlos, for nice introduction. Uh, I am a professor of analytical chemistry, but this is not important today because first of all, I am a patient 13 years after kidney transplant. Working in the Institute of Environmental Engineering, Polish Academy of Sciences, I am also involved in climate change, searching for new substances. And what I can say is that definitely climate change has a very strong impact on our health, on our behavior. So as a patient, I could say that we have to, first of all, we have to be aware because we are not aware how climate change has the influence on our health, not only on kidney, but more details maybe later I will tell you, but definitely we know that this is a strong relationship between climate change, between environmental quality and kidney diseases. Thank you.
No, thank you, Ragmund. And which environmental factors such as heat exposure, water scarcity, or pollution could have the greatest impact on kidney disease, on kidney
Mhm.
patients?
It's hard to say because, in my opinion, all of them are very, very important. Of course, water scarcity, air pollution, for instance. From analytical chemist point of view, I would like to say that in the end of 19th century, it is estimated that we had in environment around 300,000 different substances. Recently, we are in the year of 2026. According to the Chemical Abstract Service, we live with more than 250 millions of substances. It's a really, really very, very lot. Of course, we don't have contact every day with all of them, but what is important, on the level of 10 to minus 12 percent, we can have a contact daily with around 1 million of substances. So what I want to emphasize, of course, water is very important, food quality is very important, and also air quality. For instance, I would like to say that every day, every day, I mean every 24 hours, we have to breathe. And maybe it's a question, but maybe you know, we have to breathe and we use every day around 10 kilograms of air through our lungs. So the air quality is absolutely very, very, very important, as well as food quality. And one more one I want to say is if we if you are talking about air quality or water quality or food quality, we say, okay, today air quality, I am in Warsaw, in the capital of Poland now, and I know that air quality is today very good. But what does it mean? If we want to say it about only few parameters, in case of air qualities, we take into consideration some sulfur dioxide, ozone, particle matter, and so on. It's okay. But what about the rest of the chemicals? We live not only with these 5 parameters, but millions of. So from analytical point of view, we should be aware about the environmental quality, how it has influence on our health, and also I want to say that we should analyze more parameters than only 5. In case of water is 50 maybe, but more and more. Thank you.
Okay, no, well, thank you, Ragmund. We know it was a difficult question to answer, and I think these were very impressive figures that you told us. So thank you very much.
It's
Maybe
true.
Juan Carlos, let's continue now and let's move to the policy and system perspective.
Yes, thank you, Monica. We want to move to sustainability and policy perspective, Paulo. And regarding this topic, how can healthcare system balance the need to provide essential treatments such as dialysis that you know perfectly, with the need to reduce environmental impact?
Okay. Hello, everyone, and thank you for having me in this webinar. Thank you, Juan Carlos, for your introduction. Before going asking to your question, let me make as a little side note. In 2028, so like Professor Rajmund, I'm also here mainly as a patient. So I'm a policy officer in sustainable energy systems. But in this webinar, my hat is mainly from a patient perspective. So in 2028, I will be celebrating my 40th anniversary as the first time I entered in hemodialysis room. So in this period, I made some calculations, estimates of the energy, water, and resources that I've consumed. So 110 megawatt hour of electricity. So this for 6,000 dialysis sessions, 3 million liters of water, and around 40 tons of CO2 equivalent. This not having in account the transportation, so only the treatment itself. So this to illustrates the impact of the dialysis treatment. This would not be possible, of course, without a very strong social security system that we have in Europe. And all of us kidney patients should be very grateful for this huge network that we have. So having this as a little side note to my response to your question. So dialysis is life sustaining. So the first principle should be clear. Sustainability cannot compromise safety or quality of care, but that does not mean that environmental impact is untouchable. Dialysis, especially hemodialysis, resource intensive, like I said previously, in terms of water, energy, consumables, and waste. So the real challenge is to reduce resources per high quality treatment, not to reduce care. So because we should have always in mind that sustainability and efficiency has two premises: reducing energy and resources, but maintain or increase the quality of the output, the service, in this case, the treatment.
Of course, Paulo, this is one of the objectives of kidney care, to offer the patient perspective in order to ensure the same quality of the treatment is possible.
Yeah. Let me just start, because before this is in terms of the treatment, but the more sustainable treatment is the one that can be prevented. So the prevention is key, is a fundamental part of this equation. So and that's it. This is the second part, in terms that what should be the main driver of the policy, energy policy designs.
This is the second question, exactly. What role can national energy and public health administration regarding environmental policies, what role can play in supporting more sustainable healthcare infrastructure, including dialysis treatment, for instance?
Well, yes. So national energy and environmental policies can create the framework that allows healthcare infrastructure to become both lower carbon and more resilient. In Europe, many of these policies are already being shaped by the broader Fit for 55 agenda, as you probably are aware. So with national plans translating targets on decarbonization, energy efficiency, and renewables into concrete action. In particular, the national energy climate plans that every member state already submitted to European Commission last year. So this is the broader framework. For dialysis centers and other critical healthcare infrastructures, this means that energy policy should not be seen as separate from healthcare policy. It should help facilities reduce consumption, improve efficiency, integrate renewables where feasible, and strengthen security of supply. I think this is particularly important for critical infrastructures such as hemodialysis units. They should be explicitly considered in resiliency planning, including backup systems, storage solutions, and energy security requirements in practice. That may mean on-site solar, battery storage, better building performance, and contingency planning for grid disruptions, like we experienced last year in April. So the key message is this: national policies can provide incentives, standards, and investment frameworks so that healthcare buildings are not only greener, but also safer and more robust in times of climate and energy stress.
Thank you, Paulo. At the center of this discussion are, of course, the patients, the kidney patient. And Monica, back to you.
Yeah, great. So this question is for both of you, but maybe we can start with Paulo. So how can policymakers and researchers ensure that patients are actively involved when designing sustainable care strategies?
Since the beginning of my participation as a kidney patient in associations, I've been advocating the participation of patients, not only at the end of the process, but since the beginning. They should be involved from the beginning with priorities, research questions, and implementation pathways. So, and in this framework, patient organizations are especially important because they bring collective experience, not just individual testimony. So, and that's it. No sustainable kidney care strategy should be designed without structured patient involvement, without research that includes patients and patient organizations as partners.
Thank you, Paulo. Do you have, Rajmund, anything to add to this question?
Yes. First of all, I would like to totally agree with Paulo, what he said before. But from my point of view, I represent Polish patient. We have in Poland, we have around, we say 10, maybe even 15% of people with some kidney problems. But I thought about the definition of patient, because from my point of view, patient is somebody who has already a diagnosis. So only 5% of them we can call a patient. Patient should be very active in some actions like Pablo said before. Sorry, not Pablo, but Paulo said before. And what can I add to this? Education. Education, this is a reason why we provide our association. Education, people, also patients should be aware what can they do, and also we have to remember that most patients are really rather old people, so they may be not so very active, but we should emphasize them, we should help them to access to the new solution, new knowledge, and the situation is totally different. I remember in Poland, I am 63 years old, so it's a really old man. I remember in 80s in Poland, if you had a kidney problem and you needed dialysis, you had to go to the doctor and a special commission. They ask you, first of all, about your age. And in 80s in Poland, if you were 30 years old, they said, oh, you are too old. We cannot help you because we don't have access to dialysis station. Now the situation is totally different. So it's better for patients, but still we have a lot of work to do as an association.
Thank you both. Yeah, completely agree. Let's now start with Rajmund. So, how can sustainability initiatives avoid creating additional barriers or inequalities in access to kidney care? Now that you were talking about how it was back in the 80s, how can these sustainable initiatives avoid creating these barriers?
Next, very hard question. I think that sustainability initiatives. Let me also say something about the situation in Poland, because it's a little bit probably different than the rest of the Europe. I mean, in Spain, in Portugal, the situation is much better, but in my opinion, one of the very serious problem in Poland, Polish nephrology, the technologies we use the same, but is a amount of patient with peritoneal dialysis. I had a peritoneal dialysis only 1 year before kidney transplant, but in Poland it is only for less than 4% on PD. Much less than in Spain, in the rest countries of the Europe. Why?
Yeah.
From environmental protection, sustainability is not good, only for. But very probably the reason is that people going to the nephrologist, the doctor, they say, okay, you need dialysis. Dialysis in Poland means hemodialysis. I don't like to say that this is something worse. Of course, both therapies are similar. They save our life, but from environmental point of view, we should change something in this. And 4% is much too less. Should be 15, maybe 20 or more.
No, definitely, Rajmund. Thank you.
Thank you.
And Paulo, you have anything to add on this, on how these sustainable initiatives may avoid creating barriers or inequalities?
Yes, I agree absolutely with what Professor Rajmund says for this question, and I would add also the home hemodialysis. So and also the long travel. For instance, in the southern part of Portugal, we have patients that need to travel long distance to have dialysis in center. So if you or if the system puts a cap into the in terms of energy consumption for patient and limits the travel this distance, that means that some patients eventually can be out of the system or can be limited. The same for the home hemodialysis, like Raymond was saying regarding the PV. The same for home hemodialysis. So longer and more frequent hemodialysis that can be more physiological for the patient, but has a higher burden in terms of water consumption, energy consumption, and material consumption. So this is a very thin balance that needs to be in account. So the decision should not be in these cases the resources consumed, but the quality for that patient, that group of patients.
Completely agree. Thank you very much, Paulo. No, that's true. So, well, now let's look at solutions and opportunities. Juan Carlos, you can jump on here.
Thank you, Monica. My question for Rajmund in this case is, what innovation or practical changes could reduce the environmental footprint of dialysis while maintaining patient safety and quality of care that, for instance, Paulo remark before.
Yes, thank you very much, Carlos. The answer to this question is, I hope it will be visible in this article.
Yeah.
I published this article 2 years ago about the relation between environment and therapies. What is important? A lot of factors I can say. First of all, waste reduction, also water quality, water management, because as Pablo said, still a lot of water, energy, waste we produce during dialysis. Also, Paulo said about transport. In Poland, still, I know personally, I know people on hemodialysis who has to travel every 2 days around 100 kilometers one way. So you know what does it mean for the environment, but also for the quality of the life. 100 kilometers means, let's say, 2 hours plus 5 hours at hospital and coming back. So we have to remember not only about new technologies. It's very, very important about access to the dialysis, to kidney treatment technologies, but also about the quality of the life. It's more and more important because patient who has a chronic kidney disease, they usually, all of them, they want to not only live, but live with good condition, quality condition. Thanks.
Thank you, Rajmund. Paulo, something to add to this question?
Yes, I agree. I agree in absolute what was said, and from my experience as an energy auditor in the past, not in the present, but in the past, I was an energy auditor, in particular in building, but also in industry. And one thing that's struck me at the time was the lack of measurement. So we cannot manage we cannot manage what we not measure. So first and foremost, we need to measure, and there are a lot of waste. Like I used to say there are a lot of negawatts to work in. Before you go into innovation, you need to work in a negawatt. So for you to identify negawatts where you can tackle these inefficiencies in the buildings, in the water supply, etc., you need to measure. So after this step, we are eventually in the position to identify or in terms of organization, identify small innovation that can increase the efficiency. But it's layer by layer. The first layer is to measure and to identify inefficiency.
And to help in both regarding innovation and protection of the planet, how can collaboration between healthcare professionals, kidney patient organizations, and environmental science and policy accelerate the sustainable kidney care in Europe? It's a very difficult question, Rajmund, but
yes. Next,
how can
question.
collaborate with us?
First of all, we have to collaborate with scientists, with policymakers, because access to new kidney treatment technologies is very, very important. But how to say? People are more and more aware about the influence of environment, about influence of our diet on our health. So even if we have access to new medicine, new drugs, new kidney treatment technologies, we have to be aware how we can what we can really do. We don't need very sophisticated technology. Of course, we need it from the environmental point of view. Yes, it's very good to have it, but to change our life, to save our planet, we have to how to say it, step by step, be consequent in our daily life.
Mhm.
That's all. Yes.
And Paolo, for instance, one possible collaboration could be, as Rajmund mentioned before, a special education for kidney patients in order to reduce their footprint in their daily actions.
Yeah, I would agree. I would agree. For instance, to have an app where the patient can monitor. Well, the patients, everyone has apps for everything, but to somehow to monitor is carbon footprint. So, like Rajmund said, in Portugal, we also have many patients that need to travel tens of kilometers to go to the dialysis, and they need to wait for hours, etc. And there are a lot of a room for improving efficiency in terms to reduce the time and the travel. But if the patient can be aware of his footprints, at least at because he cannot control the distance of the transport, the energy consumption of the machine, the water that it consumed. But if he's aware, okay, his treatment is equivalent to this amount. Eventually is information that's it's some kind of awareness that the patient can have. But let me just add just another point to this, to the collaboration between different stakeholders, and to leave like a challenge to create a sort of net zero hemodialysis clinic. This is not difficult. Like after the second or third layer, after working of some inefficiencies, interesting pilot could be to develop some type of involving the patients, not only so involving all the stakeholders in developing net zero hemodialysis units.
Yes, Paula, this is something that we are doing in the Kidney Care project. But thank you both. To close, let's look ahead.
Sorry, Juan Carlos. I think
Yeah.
Rajmund wants to add something because he was raising his
Sorry,
hand.
go ahead.
Yes, if I can to add something to this question, I represent Polish Association My Kidney. The origin of this association is more than 20 years ago. We had in Poland Polish Association of Dialysed People. This is of course very, very important, but we wanted to enlarge this not only for dialysed people, but people before dialysis, on dialysis, and after kidney transplant. So 2 years ago, since 2 years ago, we have a parliamentary committee of nephrology in Polish parliament. And last week we had a meeting because of the World Kidney Day here in Warsaw. And for me, it was very interesting when I talk about kidney with some Polish members of parliament. They said, "Oh yes, oncology, cardiology is very, very important, but nephrology, what it is? What is the scale of the problem?" When I said that in Poland, we have every year around 80,000 up to 100,000 people died because of kidney disease. They said, oh, we didn't know because nephrology for them is a silent killer. Of course, I don't like to say that oncology, cardiology is not important because we have usually all of these diseases. But we try to be active also on the parliament level.
Thank you. Yes, of
Thank you.
course. To raise awareness policymakers is a very important point, of course. Thank you. To close, let's look ahead to the future. But in the meantime, we would like to open the floor briefly to the audience. If you have any question, please feel free to share them in the chat. Monica, your turn.
Yes, thank you, Juan Carlos. So yeah, let's look a bit ahead. I don't know who is sharing it. It's Cesar, right?
Yeah, I'm sharing it.
Yes.
And
Yes.
in the meantime, I wanted to showcase some of the numbers that we have.
Of
Like, for
course.
example, we can get some of the numbers regarding our research that was done by a group of researchers involving also Professor Alberto Ortiz, that is part of the Kidney Care Project, that they took some figures from the global burden of disease study, and it's very related to what Paulo and Rajmund they were saying, just like chronic kidney disease, that's 850 million people. They have chronic kidney disease in the world, and 95 million people just in Western Europe. And by 2050, it's going to be the third leading cause of death. So I would much very agree with the part of prevention. I think that what we can do as patients, or not as patients, as public, as the general like citizens, is to be aware that we can do some simple exams, some simple prevention exams, in order not to impact that much later on the healthcare system. Like, for example, what the research proposes is the measurement of album in urine that can detect damage years before symptoms appears. So I just wanted to include these figures and these numbers to the discussion, and also to back up what Rajmund and Paula are saying regarding this.
Thank you very much, Cesar. I think this fit perfectly within the conversation. So yeah, I think we all know, and when we see the figures and the numbers, it's more and more surprising, right? So let's now look a bit ahead, as Juan Carlos was mentioning, and maybe I can start with you, Paolo. So what would patient-centered, climate resilient kidney care look like in 2030? So in 4 or 5 years from now, it's of course not an easy question, but what would you say it would maybe look like?
Well, I can answer to that question, which is our daily struggle in our office, which is to increase the grid's resilience to blackouts, to etc. So try not to have in particular hemodialysis support that is resilient to droughts. So when we have 2-3 winters that are not rainy, and we have water scarcity, what we will the hemodialysis treatment should be maintained. What's happened if our grid suffers a blackout? The hemodialysis treatment should be maintained. What happens if the tariffs of United States or any other country disrupts the logistics supply, and the materials, the dialyzers and materials do not reach the clinic? So we should in sustainability is most and foremost this. So the quality assurance and the resilience.
Yeah, completely agree. And Rajmund, what is one concrete action that should be prioritized in the next 5 years, let's say, to move toward this vision of a more patient-centered and climate-resilient kidney care?
If you ask me about one action, for me in Poland last week in Parliament we decided to change something in this range because I would say active searching of patient because we don't have to wait. We shouldn't wait for the patient with a very strong kidney disease, but early detection is absolutely the most important for the patient, but also from the point of from economy. And in Poland, last week we decided to make, because you can analyze the term creatinine. Creatinine is a very important factor of your kidney condition. But much better is, I don't remember English name, but it's in Poland we say microalbuminur.
Yeah.
It's a ratio between albumin and creatinine. And in Poland, I hope since next year, it will be obligatory to use it. So it will help us to search a patient with early stage of kidney disease. One action.
Yeah, thank you. Of course, as we were saying, right? Like prevention is probably the most environmental sustainable action, and definitely these screening measures that, like the one you were mentioning, is perfectly yes, Rajmund.
Yeah, and one more, I forgot about it,
Of
but
course.
I don't know what will be in 2030, but I wish to have much more kidney transplant, and also much more not hemo, but dialysis,
PD.
home dialysis. Because in Poland so far, home dialysis means only PD, peritoneal dialysis. In Poland, we don't have hemodialysis at home, but it's a really very good, expensive, but very good solution from patient point of view of its life quality. And this is also one of our aim in our association to increase the number of patients with home dialysis, I mean PD and hemodialysis.
Yes, of course, and we know it's expensive, but it ends up being cost effective for the system.
Yes,
So yeah, it definitely is.
definitely, yes.
It's not only environmentally sustainable, but it's also cost effective for the country. I don't know, Paulo, if you want to add something quite fast before we wrap up.
No, it's just to um, emphasize what Rajmund has said. So and what I said in my first answer, which is the prevention. So monitoring, avoiding. So like Rajmund said, this is a silent killer. So because it's a silent killer, we need to be with more strength in the streets, in the clinics, in the home care facilities to make this make this prevention.
No, really. Thank you both so much. These were very valuable insights, and I think we could be here for forever. At least I know from my part and from Juan Carlos' part, we would love to continue listening to you. We know you have to get back to many duties. I think this discussion just keep reminding us that sustainable care is not only about reducing the environmental impact, but also ensuring equity, protecting access, and truly listening to patients. And we can just thank everybody who joined, and especially Rajmund and Paulo. I'm sure we will continue this conversation very much because we have to keep in mind actually that World Kidney Day's theme was also related to sustainability and protecting the kidneys, but also protecting the planet. So this is our year to keep talking about that. And Juan Carlos, you may want to close.
No, thank you so much both for this, for your time, and we look forward to continuing this important conversation within the Kidney Care project at Kidney Care website, kidneycare.eu, or in our website, equips.eu. Thank you very much. Cesar, you say something to add? It's your turn.
Yeah, just one last thing before just like saying goodbye to the speakers and everyone. Just to remind everyone that we will have the last webinar on the 23rd of March at 4 o'clock. And that is going to be Teach Yourself Sustainable Kidney Care, that are part of the learning courses that we have for healthcare professionals that are part of the kidney care project. It's a free course for everyone and for all the healthcare professionals that want to apply some processes to make more sustainable the kidney care. So thank you very much. Thank you very much, Rajmund and Paulo. Thank you very much, Juan Carlos and Monica, for organizing this very interesting webinar. And this webinar is going to be available also on our YouTube channel, so you can share that later on. Thank you very much.
Thank you.
Thank you very much. Thank you very much.
Thank you. Bye-bye.
Bye-bye. Bye-bye. Thank you.